Hi everyone, my name is Nicoletti. I'm a nursing student in Indiana State University, and I'm presenting the topic of stroke for my community health class, and I'm currently in LPN to BSN program. We're going to talk about stroke population at risk. So, which population is mostly at risk for stroke? Stroke can happen to anyone at any age, but most likely the older population or someone has family history of stroke are at a greater risk for having a stroke. The learning objectives are how to define stroke, identify the signs and the symptoms, identify modified and non-modified risk factors, understand the treatment options, know how to prevent stroke, knowledge of available resources. Now please pause the video and just click the link down below to take the pretest to just test your knowledge about stroke before we can move forward. So what is stroke? Stroke is a brain attack. It happens when the blood supply suddenly get interrupted or blocked to the part of brain. When one of the blood vessels ruptures inside of the brain, cause severe bleeding. There are two main types of stroke, ischemic and hemorrhagic. Smoke causes severe brain damages, sometimes cause death. The brain damages can be long-term or short-term. Stroke is one of the leading diseases to cause severe disabilities and death in the United States. According to Centers for Disease and Prevention 2021, there are about 795,000 people are affected by stroke every year. Fortunately, if you understand the risk and you know how to recognize the early warning signs and symptoms, stroke is preventable and treatable. It's very important to learn how to recognize the warning sign and symptoms because early treatment can save somebody's life. So we have lots of risk factors. We will start with non-modified, which age. The older you get, more chance you actually will get stroke. Also, if somebody has family history of stroke, also at a greater chance to get a stroke. African Americans have greater chance for stroke and also most likely cause death. Female has a higher chance of getting stroke and cause death in male than male after 65 years old. And if you have history of stroke or TIA, also puts you 10 times greater chance to get stroke. We're going to talk about the modified, which we can actually do something about it. Smoking also puts you a big risk for stroke because the nicotine and the CO2 cause severe damage in cardiovascular system and it affects the blood flow. High blood pressure is a leading risk factor of stroke. Especially lots of people that don't even know they have high blood pressure. So, of course, they don't know they are actually at a potential risk for stroke. High cholesterol is another risk factor because of the build-up fat narrows the arteries and cause blockage. When it gets severe, it causes stroke and also diabetes. Because of the high blood glucose prevent the body getting enough oxygen and nutrients, especially the arteries to the brain. Also, heart disease, because of the build-up blood plugs in the artery. And people have sickle cell disease also have high risk for stroke because of the abnormal shape of cells. Sometimes block the blood flow, obesity, and lack of physical activities because of those risk factors. And they always have bigger chance to get a chronic disease such as diabetes, high blood pressure, high cholesterol, which they are all risk factors for stroke. FAST is very important. What FAST stands for? Face drooping, one side of face drooping, numbness or uneven smile. Second, arm weakness, one arm weak, numbness or drift downwards when raise both arms up. And speech difficulties. The speech becomes slurred. And that's the time to call 911. Time is muscle. It's very important to get an early treatment. The stroke also have some common signs, such as weakness or numbness presented on the face, arm, or leg, unequally, trouble to speak or understand the conversation, and suddenly get confused. And the vision might get blurred or can't even see, lost balance, unable to walk, or suddenly get a severe headache. So we mentioned it's actually preventable. So how can we prevent stroke happens? First, get a healthy diet, such as moderate red meat, saturated fat, trans fat intake. Don't eat too much salt. Eat food higher in fiber or omega-3 to help prevent stroke. Maintain healthy weight and keep track of BMI. Be physical active, at least 30 minutes moderate exercise such as brisk walking, swimming, or whatever, just 5 days a week for adults. And quit smoking if you can. There are so many programs, support groups can help you to reach the goal. And don't drink too much. Male shouldn't have more than 2 drinks a day. Female shouldn't have more than 1 drink a day. So how do we diagnose and how do we get treatment? Physical and medical history including neurocheck or MRI, CT scan, or blood lab work. For the treatment, TPA only works when it's ischemic stroke and get treated within 3 hours. It can actually rebuild the blood flow. Mechanical thrombectomy or endovascular procedures with 6 hours of onset of symptoms are highly recommended. And the procedure removes the blood clots and reestablish the blood flow. Surgical interventions works on hemorrhagic stroke to stop the bleeding. We also have a lot of resources available. And for example, American Stroke Association, American Stroke Foundation, and the Stroke Network to get more. Another test, the post-test to see how much you learn from this video. Just click the link down below in the description box. I also have some handouts available. You can have the summary of this presentation if you're interested. Here's some sources I got from, like a lot of information from. Thank you so much.